canal treatment, also known as endodontic treatment. Let's take a step-by-step look at a modern root canal procedure. If the pulp becomes inflamed or infected, your endodontist will remove it, relieving your pain or discomfort. Here's how root canal treatment works. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. An opening is made through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening.